So we're talking about Obamacare?
Obamacare.
What did Obamacare want to do? I really don't quite understand, because I think no matter what they try to do, I'm a cynic about it, but I shouldn't be because...
Well, I think the original idea was that everybody would have health insurance. Of course, that's not really what we need. We need health care. There is a difference.
There is a difference. Health care means that you're preventative and forward-thinking, and you're recognizing what trends and issues may be causing future problems,
right?
I.e. smoking or eating terrible food for you.
Right.
Which is why the Ohio Senate is kind of looking at getting rid of junk food from our school systems, which would be a good thing.
Of course, most of the schools already have done that on their own, so it's kind of a little late with the legislature.
Well, they're always a little late to the party.
But let's talk about, this idea people get all afraid of, quote, socialized medicine.
Well, they're not so afraid of socialized medicine. We become 65 and get brand new knees. And
yeah, it all works with Medicare.
Yeah, I don't understand that whole...
And the administrative costs are next to nothing. So
anybody over 65 doesn't have a dog in the fight. They can't say anything.
Isn't that a lot of our legislators?
It's weird, isn't it?
Yeah.
Well,
they all have great golden health care plans through the U.S. Senate and U.S. Congress, and government health care is actually pretty good. I am a veteran, and I get my care at the VA. And I gotta say, I get more attention there than I did when I was going to a private practice doctor. And you know what the difference is? My doc at the VA doesn't have 4 people helping him just to fill out the paperwork.
Oh.
4 people filling out paperwork.
You need paperwork?
Apparently we need more paperwork than we need people pushing pills.
Well, pills are another issue. We get into a long thing about...
Let's not talk about the drug companies. Let's go back to just
or pills in general.
Let's just talk about the way that, people are saying, oh, we don't want the public option, or we don't want, government doling out health care. But let me put something to you. If I walk in to get a service at a hospital, there's 2 prices. There's the price I'll pay, and there's the price the insurance company will pay. I don't get the same price the insurance company pays.
You mean you can't negotiate on a cash deal, a better deal?
Apparently not.
It'd be nice if you could.
It'd be nice if they post their prices. I don't know of a business that, doesn't do that. Do you walk into McDonald's and say, I'll have a Burger King, and they say, oh, do you have, I'm going to McDonald's, can I have a Big Mac? And they say, well, do you have Big Mac insurance or not?
Well, the thing about the whole insurance thing is, isn't the theory behind insurance somewhat of a socialist model? I.e., you don't have children or a wife, but you're paying into those things, so they're recognizing that maybe you'll take less from the insurance pool than those that...
Do you remember a few years back when everybody was finding themselves with a check from their insurance company? When they switched from a mutual company to a corporation, and they bought your share and gave you cash to take you out of the ownership position you were in. Insurance companies start out as mutuals. In other words, we all pitch in, we all take out, and hopefully it all balances things out.
Yes. We are helping our fellow man. We recognize that sometimes things are going to go bad for him,
right.
So we want him back healthy in the labor force.
But somewhere along the line, these insurance companies got to privatize and become corporations and pay their executives $144 million a year. And there's no competition. There's only 2 insurance companies running most of the major markets in this country. And guess what? Here you get a choice. United Healthcare or Anthem. United Healthcare or Anthem. It's so bad that when Medical Mutual, which is like the little guy, decided not to support Premier, one of Premier's own hospitals got stuck without health care.
Well, let me just tell you, I think that made some people in this town pretty rich, didn't it?
Well, there's one guy who started a third party, another insurance company, and he did quite well when he got bought out by the 2 big guys.
Well, but that's free market.
That's free market. So back to the idea of competition. That's what's sort of missing in all these government talks right now. They're not talking about real competition. They're talking about just handing over the pie to private companies, the big ones, and letting them get bigger and bigger. We just saw what happened when Too Big to Fail happened. Now, me personally, I would rather give a couple $100 every month to my GP. I'd rather just pay my doctor and say, here's the money, than give it to an insurance company that's going to go in and tell me, my doctor, how much he can get paid. And I think my doctor would probably be happy with about 100 or 200 patients paying him $200 a month.
Well, there's
putting it in the bank.
One of the biggest sticking points to this particular thing used to believe in all this stuff. Mr. Lieberman is the big sticker on this one.
Yeah.
Joseph Lieberman. If you read today's...
Independent Joseph
Yes! Lieberman. You should read today's Gail Collins' New York Times editorial about Mr. Lieberman and his vendetta not about not getting elected to president, basically. He used to be a liberal idealist, but since he's in the home of insurance companies, he's a sellout.
Yeah, well, the whole thing about insurance companies and the way we have them today, they're not helping us get better health care. And neither is Congress or the Senate the way they're going about it. We need to look at what we really need to be spending money on. We don't need that entire middleman. That middleman, the insurance industry, is nothing different than the mob coming saying, you pay us or we shut your business down. That's what we're doing. We're paying a middleman that we don't need. And it's time to change because health care isn't optional. You can't work if you're not healthy. You can't pay taxes if you can't work. The whole system relies on having healthy people.
Well, we'd be healthier if we had less cars and had more walkable communities and ran. Get off your butt and run and stop eating terrible stuff.
All right. That's enough for today.
Bye.
Eat better.
Eat better. That's exactly correct. Eat well.